Hi everyone, my name's Harriet. I'm a podiatrist here at Fall, and today I'm going to be answering some questions on ingrown toenails. Question number 1. What causes an ingrown toenail? So there are lots of different answers to this question, but most commonly we see nail cutting technique, trauma, the shape of your nail and the skin surrounding your nail, if you've got a bony protrusion called an exostosis, or different medications. These can all contribute to the development of an ingrown toenail. Question number 2. How do we treat an ingrown toenail? There are a couple of answers to this question. Usually it's conservative or slightly less conservative. It really depends on what the toenail looks like when it's presented to the clinic. If the ingrown component is at the distal end of the toenail, usually we can treat it conservatively just with some clippers and clipping out the spicule that's bothersome. However, sometimes it's not so easy. The ingrowing aspect could be at the proximal edge of the nail. This means that it's a lot harder for us to reach, and we might need to administer a local anaesthetic to really get in there and take it out for you. Question number 3. Are ingrowing toenails genetic? Absolutely. It's very common that we see patients with their parents come in and their parents say, "Yep, I had the same thing happen to me when I was younger too." Question number 4. Can medications cause ingrown toenails? The short answer is they absolutely can. Just recently we've seen patients taking Roaccutane who've had some nasty ingrown toenails, and another common one would be chemotherapy treatment. Question number 5. How do I prevent ingrown toenails? So the easiest answer for this one would be shoe wear choice as well as toenail cutting technique. For shoe wear, we always make sure that they're adequate length and the toe box is not too narrow, as any external pressure can cause an ingrown. Similarly, with toenail cutting technique, we don't want the toenails to be too short or cut too far down the side. Question number 6. Can ingrown toenails be permanently corrected? Absolutely they can. Here at Fall we can offer 3 different procedures. The first one is called a phenolization, which is performed by podiatrists, and the other 2 will be performed by Dr. Lee Gray, a podiatric surgeon, and they're called a wedge resection and an exostectomy. Depending on what your presentation of your ingrown toenail is will determine which procedure is best suitable to you. Question number 7. Will antibiotics fix my ingrown toenail? Not necessarily. An infection and an ingrown toenail are actually 2 separate entities which coexist together. So if you take some antibiotics, you will definitely be treating the infection present, but you will not be treating the ingrowing component of the ingrown toenail. This is where podiatrists are required. The pain will not actually settle down and the ingrown will not be cured unless that spicule is removed. Question number 8. Do Epsom salt baths resolve ingrown toenails? Sometimes. Epsom salt baths will help soften the skin surrounding the nail as well as speed up the healing process. However, it doesn't actually address the nail in skin issue. Really, the only way to treat an ingrown toenail is to remove the offending spicule of nail. Question 9. Do shoes cause ingrown toenails? Sometimes. If the shoes are not long enough or the toe box of the shoe is too narrow, this can absolutely be a contributing factor into the development of an ingrown toenail. Question number 10. How do you know if your ingrowing toenail is infected? This is a really easy one. Your toe will be so red, swollen, hot, and probably have a little bit of pus present. Often, if an ingrown is left for too long, it can cause an infection. That's why it's best to get it treated as soon as one arises. If you have any further questions, please head to our website and visit our blog on ingrown toenails. And of course, please make an appointment if you'd like to seek some treatment.